When we look at the hip, all the orange stuff that you're gonna see is all of those are the ligaments that support the hip. Note in mind, when we did the stuff about the shoulder, the more mobile the joint itself with the shoulder and hips, the more ligaments gonna support that. Because you think about it, with the shoulder, we have a lot of movement. It's exactly the same with the hip, with the extension, the flexion, all the rotation that we can do with the hip. You need more ligaments to support that joint, and the surface area between the joint and the hip is very small. That's what the joint space itself. First thing that's gonna happen is gonna put a lot of strain on the ligaments. The ligaments put a strain on the glutes muscle. The glutes muscle is going to go from the back, from the pelvis itself, and going to reinsert in the femur, and that's what we call it, the bursitis. Actually, treating bursitis by itself makes absolute no sense to me. Bursitis is a sign that there's something else going on with the tendons, and the tendons are rubbing against each other. That's why you have the bursitis. Often when treat the bursitis with cortisone injection, you might feel a relief, but you haven't corrected the underlying issue, which is the muscle instability or alignment of the muscle. And the reason the alignment of the muscle are not good, because your ligaments are not strong. So the body is compensating where the muscle goes into spasm because of the ligament laxity affecting the bursa. If you really want to treat bursitis, and this is the most common thing that we see with sport-related injuries, is you gotta treat not just the bursa to help with symptoms. You gotta treat the ligaments, the glutes tendons, and you gotta treat it from the insertion of it here, the origin of it up in the butt cheek and the iliac crest, and you're gonna figure out why they have the laxity in the ligaments. You got to treat the laxity of ligaments. All of those going to prevent early progression of arthritis of the joint.